Welcome back. We're continuing to talk about chronic inflammatory response syndrome. Today, this is actually, we're talking about the new paradigm of chronic disease. This is going to be more of a summary of some of the things we've talked about, hitting some high points of chronic inflammatory response syndrome and how this disease is a new paradigm that explains a lot of other diseases that we have not been able to explain before. So why don't you just mention that? Why don't you start with that, Dr. Jenski?
Okay.
This is a new paradigm? What holes? How is this a new paradigm, and what holes in our understanding of like chronic fatigue and fibro and schizophrenia?
Gosh, yeah.
What holes does this fill?
Yeah. So all of all the holes. So
a lot of holes.
Yeah. I think that from a paradigm shifting standpoint, I mean, personally, I thought learning about functional medicine was a paradigm shift. This is taking that to the next level. I mean, when I finally felt like I was understanding CIRS, and I think you felt the same way, we've had these conversations about all these aha moments in current management of patients, but looking back at previous management, like remember when, or how about now, this overlaps with this, and it's all CIRS. And I think that's the paradigm shift. And I'm not saying that everything is CIRS, but I'm saying a lot of things are explained by CIRS. And the reality is that conditions like fibromyalgia and IBS and chronic fatigue syndrome, many mood disorders, brain fog and memory related issues, and chronic neurodegenerative conditions. I would even go as far as to say provocation of autoimmunity and potentiation of that, skin conditions, and all the histamine, mast cell, Th2 dominant stuff that we see. So much of that falls under the umbrella of CIRS for me, because I eventually, as treating those patients, come to the conclusion that they're a CIRS patient, and 9.99999 out of 10 times, they're CIRS patients. And so either we are pre-selecting out with our demographic, or this is the reality. And I think statistically, it's probably the reality. So I think that as this is gaining more mainstream notoriety, as more and more practitioners are learning about the nuances of it and understanding the foundations, which is more important than even the nuances, and we push this forward and do what we're doing right now, which is try to push it forward and provide information for those out there, I think the paradigm shifts even more. And the only thing that comes from that is patient improvement and benefit. And that's really the goal of all this. So bouncing off of that, what are the common misconceptions? I mean, like, what are the biggest things that I think people just don't get right? If we're trying to get this accepted and seen and say, here we are, and this is what these people need, what do we need to erase from a misconception standpoint?
Well, I mean, I think one of the biggest misconceptions is that mold is the primary cause of chronic inflammatory response syndrome.
Yeah.
It's like, I don't have mold in my house. And it's actually not. It's a water damaged building is 80% of this, which includes mold, but mold is actually 80% of the 80%, or 60% are endotoxins, actinomyces, particulates from building materials breaking down. So the mold actually represents, mold is about 16% of chronic inflammatory response syndrome. So if you're working with someone who's a mold expert, and they're only looking at your mold and only looking at your mycotoxins, your mold toxins, great, awesome, they'll detox you. But the reality is that represents 16% of chronic inflammatory response syndrome. And if yours is related to breast implant illness, or if yours is related somehow to your SIBO, or to your head concussion, or your overtraining, or your chronic dental infection that's not been fixed, or it's your post-Lyme, you're a serious post-Lyme patient, which is all of a sudden you're not getting addressed. So I think in my mind, the biggest misconception is that it's all mold. The second misconception I would say, like general, is this is not as common as it is. We've talked about this before. When I first started doing this, I was kind of like, there's no way. Like, I'd see a patient, I'd started learning this. I'm like, how can like 5 or 6 people I've seen today be CIRS patients?
Yeah.
And so it took me almost a year to be like, you know what, maybe this is just that common. But then the next thing was hypermobility, the next thing is mast cell activation, the next thing is dysautonomia pots. And all of a sudden you realize all these rare, uncommon things, maybe that's the third misconception, is these rare, uncommon things are everywhere.
Yeah.
It's just that it's a different presentation. You're not coming in with the marks in your eyes and, tell me, hey doc, my house is leaking and it's mold everywhere and whatever. It's like, you might have a brand new home that you moved into. And part of my wife's issues, she has issues with chemicals and formaldehyde. And that's where the whole petroleum distillate kind of thing comes in, the chemical, the adjuvant aspect, which I think Dr. Yehuda Schoenfeld, for actually a lot of his insight into this, helped me kind of appreciate how that plays into it. And And so I think maybe the fourth misconception would be that only like that we know everything that causes this. I would say the next probably big misconception. I think there's a lot more things that we're still learning about. Like you learn about the traditional things, which include Listeria that you alluded to, but like recluse spider bites. I mean, have you seen a recluse spider bite?
I have not. I've seen one in the ER.
Okay, fair enough.
Okay, so that makes sense.
Okay.
But I actually have had 2 or 3 patients that have a history of brown recluse spider bites.
Fair enough.
And when I diagnosed them as a CIRS patient in the now because they have a sick building, they're like, hey, I had a spider bite as a kid. Does that matter? Yeah, that matters. That added to your biotoxic burden. That's probably when this all started.
How about the scorpion? You seen a scorpion bite?
No, I've not seen scorpions. Snake invasions or others. And we've seen some of those, but in the ER.
Yeah, but the thing is that like this understanding of what causes this is getting bigger.
It's going to grow
and bigger. And that's where I feel like, people with post-vaccine damage, which is Asia syndrome, part of autoimmune inflammatory syndrome induced by adjuvants, which is Schoenfeld. It's actually, I think the first publication was 2010, maybe. It was a while ago. Like it's an rejuvenation thing. And when you see how he describes it, it's like, this really sounds like chronic inflammatory response syndrome. Part of his thing is leaky gut, chronic infections, adjuvants. Right?
Yeah.
So it's like, okay, this sounds very similar. And then 80% of this. So it's one of those things I feel like as we learn more about this, the misconception is we're going to learn that this is actually way bigger than we even think it is.
Long COVID is basically CIRS.
Yeah.
That's a new one to add to the list.
Yeah. And everybody wants to claim it. Like the mast cell people want to claim it as a mast cell activation syndrome,
right?
Which many people with MCAS, it's actually related to mold,
right?
Or biotoxins or whatever. So
upregulated histamine pathways,
absolutely.
Which are mitochondrial genes that you can measure and are known to be correlated with CIRS. So not everybody has a mast cell issue that's being told they have a mast cell issue.
Yeah. Well, I was actually talking with a colleague who actually is an Ehlers-Danlos expert, and she was like, no, these people don't have mast cell activation. It's mast cell dysfunction.
Yeah.
It's their mast cells, and I'm like, you're right, because you check the markers, they're not elevated.
Yeah.
Not mast cell disease, but their mast cells are dysfunctional.
Yeah.
And they are getting neuroendocrine, neurohormonal immune responses. So you can have a trauma trigger, a stress trigger, whatever, that elicits this weird somatic response that's mediated through your mast cells. And then all of a sudden now you feel better on, hydroxyzine or Claritin and Zyrtec or rupatadine or whatever we're using with quercetin or some combination.
Yeah.
And the fifth misconception, it came in left. The fifth misconception came in left. It came to me.
So we got, it's not all mold.
Yeah.
It's way more common than you think.
Yeah.
There's way more out there that we still haven't discovered, but we know that it goes beyond things like sick buildings, and we have other things involved. What was the fourth one again?
The other thing, like limiting, like it's going to be all these other things,
right?
And then the interconnectedness.
Yeah.
Like it's like you have these people that are in their little. I'm a mold expert. I'm a Lyme expert. I'm a mast cell expert. I'm a gut expert. I'm a hormone expert. I'm whatever the expert is. And the reality is that the other misconception, you really need someone like this is holistic.
Our human expert.
You need a human. Yeah. You need that. I love that.
You need a human expert.
I love that.
Right.
Yeah.
Yeah.
I'm gonna say that. I love. I'm gonna steal it, man.
No.
Trademark.
I'm trademarking.
And I'm stealing right now.
Yeah.
No. But yeah, you need a human expert. Someone who can walk, can dance between those areas. And if you have a mast cell flare, let's control that down. If you're chronic fatigue fibro flaring, let's bring that into relapse. It has the tools to help you with that. Because a lot of our people we see have been to the experts in this field across the country.
Well, that's the antithesis of functional medicine. It's compartmentalization, right?
Functional compartmentalization.
Right. I tell every patient, like, the whole point of what we're doing here is to see you as a system of systems and you as you and you alone. So by that nature, it doesn't matter if you say you're functional or integrative. If you're subspecializing, you're actually kind of counterintuitive to what functional medicine is. Now, you might be doing that because that's the area of focus for you, because you have a personal story attached to it, and that's all you want to focus on. As long as you are informing patients that this is all I'm treating and there are other aspects that need to be treated, and I'll work with your other provider, that's fine. But to be misled into thinking that it's just this issue is to be misled. The reality is that it's all the things, and every person is a little different potpourri or amalgam of this kind of mashup, genetic dysregulation and mitochondrial dysfunction and mast cell activation. Some are lit up like mast cell Christmas trees, and some have no histamine issues whatsoever. Still a CIRS patient.
Yeah.
It's not all created equal. That's the point, right?
It's true precision medicine for people with health issues. It's precision medicine, not on the side I'm making you an elite athlete. It's precision medicine. I want to get your body to heal. So you can normalize.
Let's normalize, then let's optimize.
Yeah.
How much credence? I don't know that I know my answer to this, but we can come up with one.
Yeah, we'll make one.
Like, how much credence do you give to diet in these cases? I mean, besides the obvious stuff, like say your CIRS patient came to you and said, what should I be eating? And more importantly, what should I not be eating? Besides the gluten thing that we alluded to because of gliadin antibodies.
Well,
do you put them all on low mold diets and make them just eat certain things, or how do you go about doing that?
Have you tried that diet before?
No.
It's
hard.
It's ridiculously restrictive. And how many of these people already have some kind of trauma?
Right.
So
food related.
Just
pure in general. Yeah.
Pure. It's like you have this brain trauma from either the disease proper or this trauma because you've been ignored or whatever. And so then you come and see me, I'm like, let me restrict you more than you ever been restricted before. It's like, and so I think with the diet, I am such a big, eat real food. Like we talked about the lipid medicine, and part of the Heyman's addition is doing lipid exchanges.
Yeah.
It's like if you just only eat real extra virgin olive oil.
You talked about how you healed and are healing Anna with that.
With phosphorylcholine, you get egg yolks, you get these really healthy forms of fat. So many people don't realize that the seed oils, the expeller pressed oils, fried oils, anything fast food, anything you get at any restaurant anywhere, those oils have been chemically modified to stick in your cells. I actually gave a talk about this, and I was talking about how, what is solidified oil? We call that plastic, right? Plastic. What is partially solidified oil? We call it margarine and Crisco.
Yeah.
And so when you do these products, you're literally making, this is not
plastic cells.
Kind of, sort of, yeah. And so what happens is they get stuck in your cell membranes and affect cell wall vibration, cell wall function, which affect every hormone in your body. And all of a sudden now, like something as simple as just eating real healthy forms of fat can be a game changer. The whole thing of gluten, it's like, find bread that has 4 ingredients in it.
Yeah.
If people want to eat gluten, fine. Make your own homemade einkorn bread. And the answer is people aren't going to buy the mill grain. They're not going to buy it's just, if you can't do that, don't eat the stuff. And so I think eating real food, and I tend to say paleo principles, which is you don't eat, grains are fillers. Grains are usually they're not healing foods. Like I want you to heal your gut, heal your brain. I don't say eat a bunch of corn.
Right.
I don't say, I say, why don't you get some green leafies, some root vegetables, do some beets, Jerusalem artichoke, whatever. And so I think people need to really think that food is a drug.
Yep.
If you give your body the raw material, one of the big parts of chronic inflammatory response is gut health and fixing the gut microbiome. Like, how do you move the gut microbiome forward? You're a C-section. You had a bunch of antibiotics from your kid. Your parents sprayed your house with chemicals. That's like everybody's story, right? And so, how can you move that needle? You can use food as a medicine,
fermented natural probiotics, prebiotics.
Yeah.
The 3 Ps I tell patients: prebiotics, polyphenols, and phytonutrients. Yeah. It's a fancy way of saying colorful fruits and vegetables, mostly vegetables.
Yeah.
And I think fiber is important because it's also helping with detox. Fiber is important because it's also helping with short chain fatty acid production, like butyrate, which we now know is a natural GLP-1 agonist. So it's regulating satiety, and most of these patients have leptin resistance. They wind up with metabolic dysfunction. So if you're pushing the microbiome forward naturally, if you're improving fiber to help with cardiometabolic risk and satiety and insulin sensitivity, because these patients get an intracellular insulin resistance because of hypometabolism, they're going to get dysglycemia. Balance it out. You want to go with quality protein. You want to make sure that they're getting healthy fats. All the things you said. That's kind of how I do it too.
Yeah.
Like if we do food sensitivity testing, obviously that's specific to the individual. If I do blood testing or some other and note that they have significant nutrient needs, I'm going to dedicate towards that. Like your omega-3 to 6 ratio is garbage and you're totally inflammatory. Here's some fish oil bottle. But by the way, also eat chia, flax, hemp, walnuts, and cold water fish, that kind of thing. So cool. I do the same thing. Yeah. And that's really.
And I think one of the things that I've kind of realized is nature's toxin binder is fiber.
Yeah.
You go to places like Sub-Saharan Africa where they have no cardiovascular disease, no cancer. They're eating like 80 grams, 120 grams. Yeah. I don't know how it happens, but it works. But you look at the average American's eating 12 to 15 grams a diet, and we recommend 20.
Yeah.
It's like we're not eating enough to feed the microbiome, and then the insoluble fiber that binds the bile and all this other stuff, we're not getting enough of that. So all of a sudden, using food like a detoxifying agent, you know? And so I think you need to think about food like that way. And so many of my patients struggle with that aspect. And that's one of the three major sticking points where people don't heal. I call it the triangle of health. You know, what's a major place people get stuck. There's my patient. Whoa. Whoops. Anyway, I lost that. You grab that.
Sleep.
Yeah. Sorry.
Sleep is one of them.
So sleep is one. Gut health, which gut health includes food. Gut health includes all kinds of stuff. And then stress.
Yeah.
And stress is part of that is the trauma aspect of stress, where, as you know, part of some of Heyman's work has been the gene testing showing you can actually people's genes light up as if they had
PTSD.
Yeah.
Yeah.
And it's the finger molded building.
Yeah.
Or water damage building. So I think that's understanding that aspect of things and realizing your illness can cause you to have trauma, just like a abused dog. And these little triggers, all of a sudden your brain goes off and you don't understand it. You have these mood swings. How's your body going to heal when literally your neurological system is just waiting to pounce? That affects your healing process.
It absolutely does. I mean, it centralizes it and hardwires it. And I see in some patients where their objective data is getting better, but clinically they feel the same. And, that's the only way I can explain that. It's like your numbers look great, but you don't feel well. This is centralized. This is becoming hardwired. We need to unhardwire it or rewire it or whatever you want to say.
Brain retrain.
When you're talking about plastic cells, that's not plasticity in a good way. Like neuronal plasticity. That's bad plastic.
Yeah, bad. I'm sorry.
Yeah. No, I know. I get it.
You would take it there. Yeah.
No, I get it. Most people will realize that. Like, this is not about flexibility and rewiring. This is about rigidity and damage.
Yeah.
And I think that's a really valid point. I love how you explained it in that way, where it's like solidified fat is plastic, basically. Like that's what happens because we see, like, that's the whole point of the lipid protocol, right? The lipid rescue and doing these exchanges, these oil changes to get those very long chain fatty acids that are causing lipid rafts to go away, right? To let the cell membrane work a little bit better.
I mean, I've had so many people who can't tolerate cholestyramine.
Yes.
They react.
Yes.
They have a herx. They can't tolerate anything else. But then
lipid exchange.
You give them phosphotylcholine.
Yeah.
You get them balanced omega-3/6 orals.
Some butyrate, some biosalts.
And all of a sudden their brain kind of starts working again.
Fiber, saunas, coffee enemas. That's how I've gotten a bunch of them better without being able to tolerate binders.
Yeah, exactly. Even like the phosphotylcholine actually turns into acetylcholine, which activates your parasympathetic nervous system.
Gets that gut working, gets that brain chill.
Biofilms.
Yeah.
Your biofilms, the primary phospholipid in biofilms is PC.
I feel like I need to start using more lipid protocols.
Probably do we?
Yeah.
Okay,
I love lipid rescue. It makes it easy, but I think the old school PC and body balance oil and the oxbol and butyrate is kind of the way to go.
Yeah,
or it's too kind of intense for a lot of patients. So
some people it is, but
lipid rescue is nice.
Lipid rescue is nice. And one thing that I've done, and we talked, I've mentioned this somewhere, is I would actually take the omega-3/6 oil and make mayonnaise out of it.
Yeah.
Put it in my fridge.
Body balance oil.
Yeah, exactly. Yeah. And so make mayonnaise out, which is super easy to do.
Yeah.
And all of a sudden it's like
brain mayo.
Brain mayo, that's right.
Trademark that.
Yeah, I should. Man, I should. Well, actually, I think Patricia Kane actually gave me the idea for mayo, so I can't.
She doesn't remember. Trademark it.
No, I'm not gonna do that now. I don't roll like that. Yeah. But I got the idea actually from around. She may have called something different. This was like years ago.
Yeah.
She's like the person I learned a lot of good stuff from. So, that's one of the things I do. I find the smartest person I can find, and I kind of attach to them and suck as much knowledge as I can out of them.
Thank you. That's cute.
And then I fall off and kind of like a little leech, and I kind of digest it and look for my next victim to attach onto and do a brain suck. But I think this paradigm that's important.
What about prevention? Let's talk about that. I think that's another big
prevention. Great prevention.
Like I'm there. Okay, I'm on my way out of CIRS. How do I never go back to this hole that I've been living in, this pit of misery? Help me, doc.
So part of that is you have to make the basics of the basics. Professional soccer players. The church we used to go to, like almost all the pastors were professional soccer players.
Now you're speaking my language.
Yeah.
Man.
Well, okay, perfect, awesome. And you're talking to these guys who I got really good. Like all we ever did, we drilled the basics. Mm-hmm. We perfected kicking and passing. It wasn't cool and sexy. It was just like they perfect the basics, and being perfect at always kicking the ball the right way.
Yeah.
Always, that's professional athlete, right? And so people need to look at I need to become a professional athlete at the basics, the foundations. I really just need to eat real food all the time. People like, oh, I'll cheat on, Sunday. I personally, my wife and I had a while, we were doing date nights for a while. We go out every week and have a dinner somewhere. And 6 months into it, we both gained weight and we're not doing so great. Just one meal a week. And your family's a great example. You kind of are hardcore where you don't.
We don't go out to eat.
We
do sometimes, rarely.
Yeah, but make the foundations important, like sleep. Don't sacrifice your sleep. The environment, the house is so important. Like I'm weird. I have like HEPA filters in my kids' bedrooms.
Yeah.
On our air handler, I've got
we do the same.
A pre-filter with like the little one of the ones we have UV light. The other one we have it's in the crawl space, which it shouldn't be. We have an air scrubber. But like we make sure the air in the house is clean.
Right.
I make sure we remove all the chemicals from my house. We only use really clean materials. So make our environment a sanctuary.
Yep.
So
natural products to clean.
Making
sure your HVAC system, if you have one, works and is upkept and filters are being replaced.
Yeah.
Having individual air purifiers, bedrooms bare minimum, filtering water.
Absolutely.
If you have a crawl, it needs to be encapsulated and dehumidified. You need to know what's going on with your roof, how old it is, and if it needs repairs. You need to know what's going on with the flashing, if you have a fireplace. Like for me, those are now, like I didn't know any of this stuff. And now that's the norm moving forward. And these are the things that we learned and have people that help us keep up, right? What else?
So stress. Like, okay, you've been through this traumatic thing where you're sick for 3, 5, 7, 10 years, where people thought you were crazy. And then you finally worked your way through it. People told you there's nothing wrong with you. It's all in your head. Oh, I can't help you. And now you're like, wait a second, I got something real, and you've worked through it. You need to realize that it's like, the knowledge I give people, it's like you start a fire, then you put the fire up. What's left at the bottom of that fire? Coals. Coals catch on fire a lot easier the second time.
Yeah.
And so like, how can you put yourself that brain body axis, the neurohormonal, neurogastro, neuroendocrine, like that, psycho neuroimmunoendocrinology is the fancy term for that. But how do you put that in a state of 99% rest and repair so that when you do have the 1% event, your body will address it and go back to rest and digest, And that's where you have to have what's your daily meditation practice, prayer practice, breath work, what's your weekly practice and what's your monthly practice. And you have something on some kind of quarterly, annually based basis where you kind of pull yourself away and kind of reassess that. I think that's where a lot of people get stuck or spiral back out, as they will get better and then they're like, okay, I'm gonna do everything I used to do.
Yeah.
And it's like, no, you can't. Like,
this is gold.
People always ask,
so true.
People always ask me, when do I get to eat like everybody? When do I go back to normal? I'm like, normal's sick. 60% of Americans have one chronic illness. 4% of kids in our country have a diagnosed illness. Like, sick is the new normal. You don't want to go back to normal. You want to go to optimal, which is not common. So it's just changing people's mindsets and realizing that you really need to keeping yourself healthy needs to be a priority. It can't be like, I'll worry about when I'm older.
It's a full-time job, not a part-time job. I mean, it's hard because it's alienating, and that is not easy.
That's been one of the hardest things for us. It's been super alienating.
It's alienating, and someone who isn't going through or hasn't gone through the same thing does not understand. I mean, that's why all these groups that pop up on Facebook and other social media platforms and wherever else exist is for commiseration, because there's a sense of, I don't feel as alone. Now, they're not always helpful because they're just bad mouthing people and saying they're never going to get better. And then there's a lot of negativity. But, the reality is that people feel alone. And sometimes it's not the family. Like, your family might feel alienated. My family sometimes feels alienated. It's an individual within that family because the rest don't feel sick. Like, it just makes it hard. You have to create and carve your own path. And not everybody is a trendsetter or a pioneer, or whatever terminology you want to use. But that's the only way. I mean, for me, that's the only way I see forward. And I often say, when people are like, well, why don't you do that? That's not in my health plan. That's my default answer. Why don't you drink alcohol? It's not in my health plan. Well, why don't you go out to eat? It's not in my health plan. Why don't you? It's not in my health plan. And then they just look at you like, okay, they just stop asking because it's fine, right? Like, I don't need to explain to anybody. I know what I felt like and I know what I feel like. And that's a big difference. Yeah. What's your go-to for this kind of reset? You mentioned like mindfulness, breath work, and some others. Like, what have you had the most success with? Because I feel like So, like every patient struggles with that.
It's we're actually going to be launching a stress course that's actually going to be walking through a bunch of stuff here, hopefully sometime soon. By the time this comes out, hopefully it'll be out. But what I found success, but it really depends. I've got a toolkit. My wife talks about when our son almost died, she got a traumatic event, and what kind of got her out of that spiral was actually breath work.
Breath work.
Yeah, was doing holotropic breath work for an hour, and it actually broke in her mind that spiral. There have been I've had patients with concussions who've developed horrible anxiety with it. The flotation, the sensory deprivation has been really, really helpful.
I'm going floating on Friday. Actually.
You are? Okay,
yeah.
Cool. Awesome. Yeah.
I'm back. I'm getting back into it. Thank you for that. I just went back and it was nice. I enjoyed
one thing I'm actually going to come to that is massage. You have to use real oils.
Yeah, that's always been a part of my health plan.
But it's really because I'm doing this fascia work thing right now, and fascia is its own organ that connects all your own organs, and something like 60-80%, between 60 and 80% of all your nerves are sensory nerves, and there's actually 80%. And your fascia, so your fascia are always just getting all this input to your central nervous system. It's also where your lymphatics sit, and fascia work for a lot of my hypermobile patients is key. Again, 20% of the population is hypermobile.
Yeah.
But just that massage, not only does it help with lymphatic flow, it has this really massive calming impact on your central nervous system. And I was at this meeting this past weekend, and one of the guys there was he's like, I had this episode, and he basically did this thing for a month. We got massage a day, got for 30 massages. I'm sure he missed them, but he said in that, it just changed my life. Like all of my anxiety, just
that's totally awesome. That doesn't sound logistically sound for most people.
Well, it's funny because there's some other people who he put this challenge out, a couple months before at one of the meetings. And so there was a guy that did 12 and 15, and they're like, but it was interesting how many of them were like it really did reset my anxiety level.
Gosh, yeah. I mean, I would get one every other day if I could. I get one every 3 to 4 weeks, and it's a game changer. It's been part of my health plan for as far back as I can remember. And getting the right practitioner is really important. I get cupping done. I get all kinds of body work in that way. That's really, really helpful.
I found about some people do really well with acupuncture.
Cupping, acupuncture, acupressure, hot stone, massage, myofascial release, all of that's fantastic.
I really like breath work though, because it costs people nothing.
Portable.
You can do it wherever you want to. And there's literally a type of holotropic breath work. It's usually about a 3-hour session. And you can create a similar psychedelic response to doing ayahuasca or psilocybin, where you get that disassociation with the reset.
Yeah.
But instead of using a drug, you're using your breath. And I'm kind of like, why don't people do that?
Have they done studies to show if that taps into the default mode network the same way that psilocybin does or not?
I don't think so. I think that's people, but they've been studying psilocybin.
How cool would it be if they hooked somebody up to a functional MRI and had them do that breath work and measured what it was doing? I feel like they've done that with mindfulness and meditation.
Oh, that'd be a good idea.
I feel like that would be a really cool study. Anyway.
Yeah. So breath work.
Yeah.
And there's different types of, there's regular breathing, there's holotropic breath work, different bunch of stuff, meditation. When I got COVID and I got really anxious from it, I basically went to breath work and flotation, kind of broke my anxiety cycle.
Yeah.
There's technologies. I've used some of the technologies. I have those listed on my list of your patients. I just haven't had those be whoa, kind of amazing. Mine is neurobiofeedback, but neurobiofeedback is just really it's expensive.
Yeah.
And so most people it's outside most people's kind of reach to do that.
Cool. That's a ton of great resources.
Yeah. So,
and we have a really good, you had put together a really good kind of trauma limbic retraining template that we give to patients.
Yeah.
A lot of that stuff is on there.
Yeah.
I use it all the time.
Yeah.
Patients love it because it's like a 3-page menu, and you just pick what you want and see what resonates with you.
Exactly. That's the point.
And then you move on to the next thing if you don't find something successful in your first choice. And I think that's the goal, because a lot of that is providing ownership to those patients and allowing them to not feel like they're in a room having to perform a certain way to break through some anxiety, PTSD cycle with some practitioner staring them down. Sometimes it's just, I want to read a book, or I need to do this breath work on my own, or I need to do DNRS, or whatever the case may be.
Yeah.
Cool. Yeah. All right. What else?
So this was the wrap up from the thing. We'll be talking about some other topics a little bit next time. Battleground myths. I think we talked about diet. We talked about the comprehensive approach multiple times. Maybe that'll be it for this, and then we'll kind of next time dive into.
I'm looking forward to talking about the myths. I'm looking forward to talking about some of the mold wars today, and unfortunately, the separation and non-standardization of this with the different camps and factions.
Yeah.
Everybody well-meaning, but it is what it is, and we have to kind of speak our mind about that. So that'll be one to stay tuned for.
Yeah. Sounds good. All right.
Cool.
Thanks for showing up, and we'll talk to y'all later.